Welcome back to Thursday Thoughts. This is episode 3 of our video series where we will be discussing healthcare, and our guest is Kim Nelson, who is the congressional candidate for the 4th District in South Carolina. So, thank you for coming on, Kim. And if you would like to introduce yourself and tell a little background, the floor is yours.
Hi, thank you so much for having me, Ryan. My name is Kim Nelson. I'm running for Congress in the 4th Congressional District. That is most of Greenville County and most of Spartanburg County. I'm not a politician. I never thought that I would be in this space. I got involved because my husband has a pre-existing medical condition. And in 2016, when Donald Trump won, Republicans pretty much immediately started attacking the Affordable Care Act. And for families like ours, it was really scary. We get our insurance through his employer, but we weren't sure if things like coverage caps or exclusionary riders would come back. And so I got involved in activism and in defeating those bills like Graham Cassidy, repeal and replace, skinny repeal, all of those bills that came up around that time. I got involved in activism to defeat those. I, called my senator and House reps every day to let them know what I thought. And then that led to getting my master's in public health and focusing on health policy. And I'll talk a bit more about the work I've done in that space in just a minute. And from there, what I really realized was that a lot of Republican lawmakers weren't making good policy, and they weren't making good policy not because they didn't know better, they didn't want to do better. It was intentional, and that's when I decided to run. My work in health policy, I've mostly focused on children's health. So I've done a lot with vaccine policy, a lot with child homelessness, which is a big problem here in Greenville County. I did my master's, it wasn't technically a thesis, but it functioned like that, on adolescent tobacco use. So I've been in the policy world for a long time. And particularly as it pertains to kids, I've been able to see how when we have people who care, who take that public health mindset and apply it to lawmaking, we can really do some good. I also am a mom of two small kids. I've got a 6-year-old and a 4-year-old. You might hear them from time to time in the back. They are watching, Disney puts their rides online, and they're
Ah,
desperate to go
yeah.
to Disney World. So we are streaming the rides right now, and they're in laundry baskets pretending to do like roller coasters and stuff. So they might get a little excited about that.
That's all right. That's the fun of the world we're in now, where everything is through the virtual media, pretty
Yeah,
much.
yeah.
Um, but yeah, I'm glad you brought up the pre-existing condition because that is a big thing when it comes to not only getting health care but maintaining your health care, maintaining your health. My partner is a type 1 diabetic, so when we start talking about pre-existing conditions, that worries me as well because it's nothing he did. It's just that's what it is, and there's no way to get around it. So if you want to start
Oh, I'm sorry. Go ahead.
Oh yeah. So if you want to start going into, policy around pre-existing condition and how we can better our health system to help those types of
Yeah.
clients.
Yeah, I think you bring up a really good point, which is most people have some kind of pre-existing condition because there's a very broad definition of what constitutes a pre-existing condition. I mentioned I'm a mom. I have 2 kids. Well, so pregnancy is a pre-existing medical condition. I have hypothyroidism, which is a really easily controlled autoimmune condition that's pre-existing. My husband's is a little more severe, or at least it can be. And he is incredibly fit. He runs, and there's nothing that he did or didn't do to bring this upon himself. There's nothing I did or didn't do to bring on my hypothyroidism. It's just part of who we are. Just the same as I have dark hair, I have hypothyroidism. And I think in this country in particular, we tend to blame people for their medical conditions. And it's one, that's just not right. And that's an incredibly privileged, I think, mindset to have. If you have that mindset, you probably have never had anything go wrong that was out of your control. Um, but what happened was when the Affordable Care Act came into play, it eliminated insurance companies from being able to prevent you from having insurance or charge you more as a result of whatever your pre-existing condition was. And I'm 35. My first job, I worked for a law firm down in Columbia, and we, my employer didn't offer health insurance because one of the senior partners had had cancer, and it priced them out. And that's how insurance companies make their money. They don't make money by covering people, they make money by getting out of that coverage. They
Yeah.
either jack up prices so that you are priced out if you have a condition, or essentially they only want to cover healthy people who don't use their insurance. They want to collect premiums, they don't want to pay out on claims. And it's a business model. Um, so the Affordable Care Act told insurance companies, no, you don't get to do that. You have to offer insurance to everyone. You can't charge people who have had cancer more than you can charge people who have not had cancer. And the idea was that simultaneously, if everyone was, you've heard the individual mandate, what that meant was that if everyone had to have health insurance and not just the catastrophic junk plans that used to be on the market, if everyone had comprehensive health care, then the risk pool would be big enough. And we wouldn't just cover healthy people, we would have enough people who were young, enough people who were low risk for certain medical conditions that it would keep costs down. Because we knew that in covering people who needed their health insurance, yeah, it would cause costs to go up. So we had to spread that risk out. And that's what the Affordable Care Act did. It didn't go far enough, especially now with Trump. He used the court system to bring the individual mandate down to zero. And then with the individual mandate being zero, the argument that it was technically a tax lost some of its teeth. And so he is challenging that. Even in the midst of a pandemic, he is challenging the courts to repeal the Affordable Care Act. And that's where we stand right now. So please, as you're voting this November, don't forget healthcare is still very much on the line. The Republicans have not let up.
Yeah, and on top of that, he keeps promoting that the repeal replace, but you and I both know it's just a repeal. There's no replacement plan out there.
No,
And
they've
that's
had
and
over a decade to come up with
yeah,
a better idea, and they haven't.
and that's well, I mean, there is a better idea out there. They just don't support that idea.
Right. Right.
And that is, Medicare for all.
Exactly. And I understand why people might have apprehension or fear. We've never had that kind of system in this country where everyone has been covered. And I can say my in-laws are British. I've unfortunately gotten sick in the UK and had to go see a doctor there. I was a student in France. I got sick there once with a sinus infection, had to go to the doctor. It's not a lot of the talking points used against Medicare for all, they're just fear tactics. I've
Yeah.
been treated in other countries, and it was better or same to the care I got home. Um, but Medicare for all is really, it comes down to who pays for it. And I don't mean
Yeah.
how much your taxes are. I mean, just, is your insurance company paying the doctor, or are your taxes? That's essentially what we're talking about. And if we cover everyone, we talked about that risk pool, then that is going to lower costs, because when we save healthcare dollars, we save them by offering preventative care. We save them by catching conditions early or preventing them. We save a lot of money when we increase our social access to social needs, our social safety net. That's where we really see the biggest savings. But I think ultimately it doesn't come down to how much does it cost. The question we should be asking is healthcare a human right or not? And if it is, then we need to stop treating it as optional, because you
Yeah.
don't compromise on human rights.
Yeah. I agree. Um, I've seen it several times, but the illustration is poverty charges interest. You can't go to the dentist to get your teeth cleaned, so you get a cavity. You can't get that treated, so now you need a root canal.
Right.
And that stretches across healthcare. You can't afford to go in and get a mammogram. Now you're further into, instead of catching breast cancer at a stage 1, you could be a stage 3.
Yeah. There's actually a book that I'm reading about. It's called The American Healthcare Paradox. They use an example of a diabetic who doesn't have safe and affordable housing, regular housing. He's kind of crashing, in various friends' homes, one of which is kind of an abandoned house, and he has to tread through kind of muddy, swampy, not swamp, but like just an area that's prone to puddles and flooding. So his feet get
Yeah.
wet, is the point. And his doctor has told him he needs a decent pair of shoes. And how much does a decent pair of shoes cost? $50, $40?
Yeah.
Because he can't afford that, he's facing toe amputations followed by, leg amputations because of diabetic neuropathy. And so it doesn't make any sense for us to pay thousands of dollars for those amputations and for treating that when we could have given him a safe place to live and a decent pair of shoes.
Exactly. Preventative care is much cheaper than, having to deal with what you could avoid.
Yeah.
And the fact that we just want to avoid that entirely to keep a system in place that's just here to make profits. I've said it several times before that, health insurance aren't here to keep us healthy, they're here to make money. And as long as they're making money, we're going to continue to suffer the health repercussions of it.
Yeah, absolutely. They're a business model, and healthcare doesn't function like a normal good. You don't really get a choice. I bought this shirt, right? And I
Yeah.
could go online, I could see exactly how much it was going to be. I could make sure it was in my size, and I could track it from, the warehouse to my front door. But with healthcare, you don't make decisions like that. You go where, if it's an emergency, you're probably going to the place closest to you. And you don't know what the charges are going to be up front, because you don't know, you know, doctors don't know upon seeing you what you're going to need. So you don't have, you know, I guess, an idea going in of what your costs are going to be. And so it's not like you're making a choice based on having all the information. You're not really making a choice at all. You're just
Yeah.
trying to survive. And that's what your medical team is trying to do. They're trying to save your life or improve your life. And cost really shouldn't be the deciding factor in any of that.
Exactly. You should be able to go in there and not have to worry about whether or not I can afford to stay alive. And if I do this, am I going to be able to afford to keep my house?
Right. Right. How far are we willing to let people fall just because they get a cancer diagnosis? And
Exactly.
from the provider standpoint, from the medical staff standpoint, they want to practice medicine. They don't want an insurance company or a drug company telling them, we're not going to cover this medication that we know or that you think your patient needs unless you try A, B, and C first.
Yeah.
Well, it might be you've already tried that, but they changed their protocols, their formularies, and now your doctor is having to repeat all of it when you could just get the medication that works. It's about control. It's about who has that right to make those decisions, and it should be between a patient and their physician. It shouldn't an insurance company should not get to make that call.
Yeah. Now that we're on the topic of prescriptions and that, we again, I go to diabetes because that's what I know.
Mhm.
And the cost of insulin is ridiculous. You're talking about a drug where the patent was sold for $1 because he didn't want people to make money off of it. And then you see companies like Eli Lilly who can produce an insulin pen for $7 or $8 and turn around and sell that same pen for a couple hundred.
Right.
So, you have people who go out there and they ration insulin or they just can't, or they just do without. and it's costing lives for something that costs dollars to make.
Yeah. And you bring up a really good point. There are state policies we could enact. There are federal policies that we can enact. Nancy Pelosi passed a bill in the House that was trying to think the original title. I wrote it down. Hang on. It was the Elijah J. Cummings Lower Drug Costs Now Act. It's quite a mouthful. But what it
Yeah,
essentially did, it allows the government to negotiate drug prices, and it explicitly includes insulin for that very reason, because it is a life-saving drug. It is a necessary drug, and you don't get to, if you need one type of insulin, you don't necessarily get to have another type that is acceptable.
yeah,
Um, and so it's a good bill. It's a bill that is really ambitious, and it passed the House. And of course, it is dead on arrival in the Senate. And Trump promised he would veto it even if it made it through somehow.
yeah. But yet at the same time, he's also the same person who said he's going to lower drug prices
Right. Well, hypocrisy. Um,
at its finest. Yeah,
yeah, but so most employer-based insurance is regulated through the federal government. So we do need the federal government to do something. But you and I have talked about what the state government could do. A lot of states have looked to their own solutions on insulin price caps. And it would apply to those who have state-based insurance. It would apply to those who get their insurance on the exchanges. Um, and so we're not talking about a huge population, but even if we're helping some people, why wouldn't
yeah,
we?
yeah. I mean, that's the that is the kicker, is it's not going to help everybody, but at least it's going to help someone.
Right.
And at the end of the day, if at least you help someone, at least you've done something to better the world.
Yeah.
But I mean, I've always found it impossible that these companies can sit here and basically extort human lives for profit.
Yeah.
And I mean a lot of profit, not just a little bit. I mean,
No.
it speaks to morals and ethics and that there are none.
Yeah. And so insulin is a really old drug. It's been around since the 1920s. But even emerging drugs or drugs that have come on the market relatively recently, a lot of that research that leads to those new drug developments is taxpayer funded. Those
Yeah.
are coming from NIH grants. So the American people are the ones kicking that research off the ground, and yet we're being price gouged
Hmm.
when it comes to market. But we're the ones that got it off the ground in the first place. That
Yeah.
just it's morally reprehensible.
Yeah, because I mean, you look at it, we're paying for the research, so it's virtually costing the company nothing to develop this new drug, and then they're able to ask whatever they want.
Yeah, yeah. And a really good example of that is are the drugs used to treat hepatitis C, which hepatitis C is a virus that affects your liver, and it can be very costly to treat. We're talking like $80,000 for a round of treatment. And the thing is, we can cure it. We can cure Hep C, and it goes hand in hand with the opioid epidemic. So you can really see hepatitis C rates just take off as the opioid crisis has also taken off. Um, and we can cure it. But because the drug is so expensive, we wait for people to essentially be at the end of their life, like on death's door, before Medicaid will cover it
Yeah.
because it is so expensive.
I mean, it's just crazy to think that it's more important to make money than it is to save someone's life.
Yeah.
I mean,
Yeah.
it's different than, trying to sell someone a shirt. They're not going to die if they don't get a shirt.
Right.
But if you are trying to extort someone so they can get their insulin for the month, it's just wrong. And the fact that there are people out there, people in government who think it's okay for this practice to continue because, we don't want the government to interfere in the private sector. We don't want government interference in business. But I
Yeah,
mean,
they were okay with the government funding the research.
yeah,
So,
we paid for it. The government should own it, and they should just be producers.
right. It's why elections matter. It really
Yeah,
is. If you ever wondered, does your vote matter? Does it matter to vote for a Democrat in a state like South Carolina? It absolutely does.
yeah, because you can have more of the same or you can have something new. And this is where more of the same have gotten us to insurance plans being people going on GoFundMe to pay for their chemo or to pay for the medical bills where they had to go to the ER.
Right.
You know, we are considered the richest country in the world, but yet we can't provide health care to our populace. And, currently we have several thousand people unemployed, and who knows if they're, you know, if they even have access to health care now because of the unemployment.
Right. Well, and we know it disproportionately hurts people of color, people who live in rural communities that are already seeing hospitals and healthcare providers pack up and leave or close, or um, it's it's widening the gap between people who are okay, people who get to ride out a storm like this, and people who were already on razor's edge and things have only gotten worse. Um, I think sometimes government is the only entity big enough to take on the interest of really powerful industries, and the government should be for the people. The government should, for the people, by the people,
Yeah,
by the people, for the people. We need to live up to that ideal, and it starts with who we elect and who we send to office.
I definitely agree. We need more people who, not only are from issue or, can relate to the issues at hand, but also care to worry more about people than business or worry about how their next campaign's going to be funded.
Right.
The whole point of going into politics wasn't to make money, it was to make life better.
Yeah. It's I think it's we have to get the money out of politics. We have to really limit how much influence lobbyist organizations have with our lawmakers across the board. In Citizens United was a complete disaster, and it makes it really hard to get good people into office because it does take so much money and so many resources,
Yeah,
um, that it tends to privilege a certain sect of people, and even just to run. And when we look at a state like South Carolina, which has a part-time legislature, so they meet January to June, Tuesday through Thursday, and who does that leave to run for office and to serve? Well, people who are independently wealthy, they don't have to go to work every day. People who are retired, people who own their own business or are high enough up in their business that they can take that time and essentially work part-time for half the year. And it
yeah,
leaves out a lot of everyday Americans and everyday South Carolinians who have a really diverse life experience, certainly experiences that we need in the state house, and they just can't do it. Oh, and the pay is only $10,000,
oh yeah,
$10,400. So yeah, you
yes.
have to be able to give up a whole lot or be privileged enough to where something like that isn't a
Mm.
sacrifice.
And and for me, I will be, if elected, I will be giving up a full-time job to do
Yeah.
this. So, I am taking a bit of a risk, but it's a risk that needs to be taken because, current leadership just isn't doing it.
Yeah.
And it's the only way it's going to change is if people like me go out there and take a risk and say, enough's enough.
Yeah. Absolutely. We need more young people, we need more women, we need more LGBTQ candidates, we need more candidates of color. Like every single our state house is overwhelmingly um homogenous. It's
Yeah.
and we can't make good policy so long as that power structure is in place.
I definitely agree. Well, thank you for coming on. It was great having you. Um, so yeah, so this is it for Thursday Thoughts. Thank you for joining us, and stay tuned for